And so it began. Early Monday morning, doctors and nurses in the public sector in different towns abandoned their workstations and assembled in different venues. In boardrooms and on the streets, the almost 3,000 doctors and over 10,000 nurses working in public hospitals steadfast in their resolve not to return to work until the government addresses their grievances.
What we want here is CBA paid in arrears.
In Nairobi, doctors marched to Afya House, seeking an audience with officials from the Ministry of Health, only to be dispersed by the police. The doctors' next stop was the National Treasury, all the while calling for the implementation of the collective bargaining agreement of 2013 that would see their salaries increase by 300%, a deal they accused the government of defaulting on. Patients in public health facilities across the country immediately feeling the impact of the absence of the healthcare professionals. In Muranga, an expectant woman writhed in pain on the cold hard bench, the prospect of giving birth unattended filling her with anxiety. Students from the Kenya Medical Training College would step in to help her deliver. For this family in Mombasa, it was time to make hard decisions. With services at the Coast General Hospital at a standstill, they chose to take their seriously ill father home.
Uhai wa mwanadamu ndio uti wa mgongo wa nchi yetu ya Kenya. Wawarudishe madaktari kazini ili mwananchi wa kawaida apate huduma za afya.
Baringo County Referral Hospital stopped admitting patients on the eve of the strike, with patients in the wards being discharged to seek services in private facilities. At the Malindi Hospital in Kilifi County, stranded patients waited in the wards with no one to attend to them. Here too, students from the Kenya Medical Training College would be forced to take over.
Pakae chini, waongee, waelewane, kama ni pesa wapewe, kama ni nini, lakini naomba madaktari wana roho ya utu wawe nao juu ya wanaoteseka ni watu kama wao.
The doctors, nurses and other medical staffers strike began following the lapse of a 21-day strike notice. This coming after the Salaries and Remuneration Commission released a pay scheme that disregarded the CBA of 2013. As doctors dispersed, their point made. In public hospitals across the country, patients frantically searched for alternatives as they hoped for news of the end of the stalemate.
With both sides now digging in their heels over this strike, patients are now bracing themselves even as they hope for the best. Kisii, Citizen TV in Nairobi.